For most of our lives, we think of dental care as just that, dental. You brush, you floss, you go to the dentist, and you hope to avoid cavities or dentures. It's about chewing, smiling, maybe even avoiding bad breath. But what if I told you that the health of your gums may have far more serious consequences, including a potential link to one of the most feared conditions of aging, Alzheimer's disease? It sounds far-fetched, even a little shocking. After all, how could something happening in your mouth possibly affect your brain? But the research is growing, and what it's starting to reveal is both surprising and deeply important for anyone over the age of 60. In this video, we're going to explore the powerful, little-known connection between gum disease and Alzheimer's, and more importantly, what you can start doing today to protect both your oral health and your brain. And if you're new here, welcome to Senior Health Haven, your trusted guide for senior wellness, healthy aging, and protecting senior health after 60. If that's what you're after, hit that subscribe button and join our community. Let's get started. What exactly is gum disease? Let's start at the beginning. Gum disease, also known as periodontal disease, is a chronic bacterial infection that affects the gums and the bones that support your teeth. It usually starts as gingivitis, redness, swelling, and bleeding when you brush. But if left untreated, it can progress into a much more serious form that damages bone and can eventually lead to tooth loss. But here's the thing. Even before it gets that far, it's already doing damage elsewhere. Gum disease is caused by a buildup of plaque, a sticky film of bacteria that forms on the teeth and along the gum line. When that plaque hardens into tartar, it becomes a breeding ground for bacteria that trigger inflammation. And this inflammation doesn't just stay in your mouth. It spreads, and that's where things get serious. How does gum disease affect the brain? Let's talk about inflammation. When you have gum disease, your body is in a constant state of low-grade inflammation. Your immune system is always on alert, always fighting. Over time, that inflammation doesn't just wear down your gums, it begins to affect other systems, including your heart, your joints, and, as we're now discovering, your brain. Multiple studies have shown that chronic inflammation is a major contributor to cognitive decline and neurodegenerative diseases. In fact, inflammation is now believed to be one of the key drivers behind the progression of Alzheimer's disease. One specific bacteria, called Porphyromonas gingivalis, which is commonly found in cases of advanced gum disease, has actually been detected in the brain tissue of Alzheimer's patients. Researchers believe that these bacteria, or the toxins they release, can cross into the bloodstream and eventually penetrate the blood-brain barrier, the brain's protective filter. Once inside, they may trigger immune responses, cause further inflammation, and even accelerate the buildup of amyloid plaques, the sticky protein clusters that are a hallmark of Alzheimer's. That's a massive finding. It means that your gum health isn't just about your mouth, it's about your mind. The research. What does the science say? One of the most well-known studies in this area was conducted by researchers at the University of Illinois at Chicago. They found that when P. gingivalis was introduced into the bodies of mice, it not only migrated to the brain, it led to increased levels of amyloid beta and inflammation, two key markers of Alzheimer's. Other studies have confirmed the presence of this bacteria in human brain samples. In fact, a 2019 paper published in Science Advances identified toxic enzymes from P. gingivalis in the brains of Alzheimer's patients, and the levels of these enzymes correlated with the severity of the disease. The takeaway? Gum disease may not be a direct cause of Alzheimer's, but it appears to be a serious contributing factor. Especially in people who already have other risks, like genetic predisposition or vascular issues. So, what can you do about it? Tip number 1. Treat bleeding gums as a brain warning. For many people, bleeding gums when brushing or flossing feels normal, maybe even inevitable with age. But the truth is, it's not. Bleeding gums are an early warning sign of inflammation. And if your gums are inflamed, there's a chance your body, and brain, is, too. Think of it this way. Your gums are one of the few places in the body where you can actually see inflammation happening in real time. If they're bleeding or swollen, your immune system is responding to something. And that response isn't limited to your mouth. Don't ignore it. Don't delay it. Treat it like you would chest pain or vision loss. Get it checked out. Tip number 2. Clean your teeth, but also your tongue. Good oral hygiene goes beyond just brushing your teeth. Your tongue harbors a massive amount of bacteria, and many people never clean it. That bacteria can migrate, spread, and contribute to plaque buildup along the gums. Use a soft bristle toothbrush or a dedicated tongue scraper daily. It takes seconds, but it can make a huge difference. Also remember to brush twice a day, floss once a day, and consider using an antimicrobial mouthwash. Your goal is to minimize the amount of harmful bacteria in your mouth, and therefore, in your bloodstream. Tip number 3. Avoid smoking. It doubles the risk. If you smoke, or have in the past, you're at significantly higher risk of developing both gum disease and Alzheimer's. Smoking impairs blood flow to the gums, weakens the immune system's response to bacteria, and makes infections harder to control. It also contributes to vascular damage in the brain, another known Alzheimer's risk. If you've already quit, that's great. If not, talk to your doctor. There are more tools now than ever before to help you break the habit, and your brain will thank you. Tip number 4. Eat brain-friendly, gum-friendly foods. What you eat affects both your gums and your brain. Try to avoid foods that feed bacteria, especially sugars and refined carbs. These include white bread, candy, sugary drinks, and even fruit juices with no fiber. Instead, focus on crunchy vegetables, carrots, celery, to help clean the teeth, leafy greens like kale and spinach for antioxidants, omega-3 rich foods, salmon, flaxseed, walnuts, to reduce inflammation, green tea for its antibacterial and brain protective compounds. Also, make sure you're getting enough vitamin C. A deficiency in vitamin C can lead to gum bleeding and weak immune function. Citrus, bell peppers, and strawberries are great choices. Tip number 5. Get regular dental cleanings, even if it feels optional. Many seniors delay or skip dental visits. Maybe it's the cost, or the inconvenience, or the idea that, I've already lost some teeth, what's the point? But here's the truth. Professional dental cleanings are one of the most effective ways to prevent the spread of gum disease, and possibly lower your Alzheimer's risk. Dental hygienists can remove plaque and tartar you can't reach, and dentists can spot early signs of infection long before you notice symptoms. Aim for a cleaning every 6 months, or more often if you've had gum problems in the past. Tip number 6. Take Alzheimer's prevention seriously. Early. Most people think of Alzheimer's as something that happens suddenly in your late 70s or 80s. But the changes in the brain can begin decades earlier. By the time symptoms show up, the damage is already significant. That's why prevention, especially after age 60, is everything. That includes managing blood pressure and cholesterol, staying physically active, challenging your brain with learning, prioritizing sleep, and yes, protecting your gums. The brain doesn't operate in a vacuum. It's connected to every system in your body. That includes your mouth. Tip number 7. Use dental health as a tool for total body health. Finally, shift how you think about oral care. It's not just about teeth. It's not just about gums. It's about your immune system, your vascular system, and yes, your brain. Every time you brush, floss, scrape, or rinse, you're not just cleaning your mouth, you're reducing inflammatory load throughout your body. That's not hygiene. That's medicine. Final thoughts. It's easy to think of brain health and oral health as two completely separate issues. But as science evolves, we're starting to understand that the body is more interconnected than we ever imagined. Your gums talk to your brain, not with words, but with bacteria, inflammation, and immune signals. And while we don't yet know everything, what we do know is enough to take action. So if you're over 60 and you want to protect your memory, stay sharp, and live with strength and clarity for years to come, start with something simple. Protect your gums. If this video helped you, give it a like, and subscribe to Senior Health Haven for more weekly videos on the science, habits, and healing that matter most after 60. You, your parents, grandparents, or other loved ones deserve to age wisely, and we're here to help you do exactly that.